Hello, everybody, and welcome to this episode of the Game Changer podcast. My name's Michelle Dutro, and I have been looking forward to this conversation for a minute. And let me tell you why you want to stay tuned. I have a whole thing I'm going to read here, but let me just talk to you for a second. It's the new year, and if there's ever a time of the year when we consider, maybe more than any other time, something new, something different, a different approach, a different mindset, a different way of looking at the world or ourselves, I want you to have that as the backdrop of your mindset for this conversation, because we're going to cover medicine and science and healing and what that means, but we're also going to cover mindset when it comes to thinking about maybe things that are out of the box, even though they shouldn't be, and what it takes to actually give that thing a shot. Okay, that said, let's dive in here, because I have Dr. Jeff Gross sitting here very patiently listening to me ramble on. In today's conversation, one that I have been looking forward to for quite a while now, my guest today is Dr. Jeff Gross, a neurosurgeon who made the bold decision to step outside of traditional medicine. I mean, not probably completely, but anyway, and get into the emerging field of regenerative and immune-based therapies. Really hot topic right now, and like I said, this is one, whatever you're doing, turn up the volume a little bit and really pay attention. Whether you are struggling with something or you're smart enough to know you want to prevent struggling from something, this is where you want to be. He is the founder of Recelebrate, C-E-L-L, Recelebrate, and has spent decades studying the body not as a collection of broken parts, but as an intelligent system designed to heal, adapt, and protect itself when given the right support. We are lockstep aligned in that belief. In this episode, we're not just talking about new medical technologies, we're exploring why innovation can be so uncomfortable sometimes, and why people often resist new possibilities even when they offer hope, and what happens when both patients and physicians begin to trust the body's innate intelligence. Okay, we're going to dive in. We've got so much to cover. What, doctor, did I not say about you and your background before we dive in that people need to know so that we can set the stage and people really turn up the volume and listen?
I just want to thank you. If you wrote that, I need to borrow that. That's an incredible intro. And you know, it's great that we set aside these 10 hours to discuss these topics, because I think it'll take us that.
Agreed.
So
and everybody, like I said, call in sick. Today's the day. But we're going to take the time that we need, because I think there is a balance between understanding new innovative things that are out there and simultaneously being open enough to consider them. And so I do want us to talk about both the science side and the mindset side, because who cares if I've always said this about sales and marketing. Who cares if you have the most amazing thing in the world if no one knows about it? Who cares if you have the most amazing thing that can help put the body in a position to heal if no one's willing to try it? So we're going to cover all those bases. So that said, let's lay the groundwork. What exactly is it that you do now? Well, give us the background of your background, what you've been doing, your adult life, and how your journey led you to what you're doing right now.
Well, I'm always trying to figure out what to do when I grow up. So it's changing all the time. I'm not going to belabor the valuable time here, telling you about, each element of my resume, or what we call a CV, right?
Yep.
But a quick journey note is that I was practicing, and still am a little bit, like you said, traditional neurological surgery with a fellowship in spine. So I took care of neck and back problems. As we talked offline for a moment, I practiced in over 30 years in Southern California and Orange County and beyond. And for the last 13, 14 years, also in the Las Vegas, Nevada area, where I am now full-time. And I was frustrated for my patients, always trying to make surgery the very last thing they did, because it's still sort of very old-fashioned what we do surgically for the spine. Yeah, there's a new approach or a smaller incision or something, but it's the same thing. Yeah. It hasn't changed. I was frustrated. I was open-minded, looking for new and better options, and my patients encouraged me, not wanting surgery, but have failed all the non-surgical treatments. Hey, let's talk about stem cells, doc. And I said, well, I really didn't train to do that. They don't cover it in medical school appreciably, which,
Right.
I completed in the medieval times. But and you hear that enough, you say, listen, I've been going to these neurosurgery, spine surgery conferences for years. I've been paying lots of money. They make you pay lots of money to go to these things to get your hours. The same bow tie wearing knuckleheads and nerds, not that I'm not a nerd, because I am, uh, uh, are patting themselves on the back for doing the same thing year after year after year after year. And it really got frustrating. And so finally one year I said, you know what? I'm going to go to a stem cell conference. And I started going to those. I started going to re-educate myself. Luckily, I have undergraduate background in molecular biology and biochemistry, which is the field of stem cells. And so it was tapping back into that topic that I really haven't been able to enjoy since college, really. And it all came together. And a lot had happened in the realm of regenerative or stem cell medicine in those decades. And a lot of that science and medical evidence comes from Europe and Asia. We're very late to the party here in the US. So I
Yes.
started to add that as a tool in a missing in a there was a spot in my toolkit, and that was it. But it has blossomed, Michelle, into so much more. It's all I do now. And it's not just for the spine, it's for joints, it's for inflammatory problems, it's for recovery from heart attack, stroke, approaches we use to augment the treatment for cancer in the immune side, and longevity and preventative care. And I'm having a renewed sort of version 2.0 of my professional existence, and it's so rewarding finally, and fun.
Okay. That was a lot, and we're gonna dissect that because there's a lot of really important components. One, I want to step on before we jump into the science and why and how this works. What is the feedback that you've received from your colleagues? Because not everybody embraces, the new kid on the block doing the new thing on the block that is saying, "Wow, look at these results I'm getting."
Yeah.
Because look at it's the poppy field syndrome, right? That I don't need you getting ahead of me. So it's very
Yep.
common. I've experienced this I was in biofeedback starting 25 years ago, and let me tell you, it wasn't well received to think that we can play a role in our own healing when when we are when we take responsibility for our own health and we look at the role that stress plays and we look at what we can do to reduce that stress, and then the immune system improves and on the
Yeah.
story goes.
Yeah.
But there's a lot of people that fight that.
Yep.
And so I'm curious what you have seen in the medical community around this topic and around your kind of departure from the norm, if you will, in neurosurgery.
Yeah. No, it's an interesting question. So I have to now segment my colleagues. So my old colleagues in neurosurgery, the vast majority of them are still drinking the Kool-Aid and think I'm, out there. Just
Right.
probably like your colleagues
Yep.
did when you said
Yep.
we're gonna talk about biofeedback or in the early days. So they what they do is driven by a script that is fed to them by their training, it's years ago by people who were trained decades before them, and it just hasn't progressed, by what insurance in the sick care system will cover. And I've seen that disgustingly where they'll say, well, I really want to do this treatment, but it's not covered. So we'll do this other one,
That's right.
and it's just horrible. That's not the best for patients. Certainly doesn't go along with the Hippocratic Oath. And then I have a very small subset of those neurosurgeons who are listening to me and looking and saying, "Oh, I'm jealous. You're actually helping people and having fun and not having to be, they have this new thing called burnout, which we never had in my day, when I was a
Right.
resident, we worked all day, all night, as many in a row as you were told to. There was no limit. Now they have limits, people go home after a certain amount of hours, and sadly, they don't get the responsibility piece. And that generation of doctors they're all employed now. They're all part of a system. They're a cog in a Kaiser or a government scripted, watered down, Kool-Aid consumed, sick care nonsense. So a few of my colleagues are like, oh, that's interesting. Tell me more. I have a couple of those that are close enough with me and friendly. Now, my new colleagues in the health and wellness and the biohacking, cutting edge, natural, holistic fields, I fit right. I've always fit in there, and now I've found my people. Right, I'm more integrative. I'm more naturopathic in nature, even though I have an MD.
Right.
And I'm actually looking to get some of those credentials because I think there's so much they add to temper some of the nonsense we got in the medical training, which probably was half wrong.
Like I said, you and I have a lot in common. So we would definitely be playing for the same team. I appreciate that. All right, let's keep going. Now, someone's listening and they have no idea what we're talking about. So just give us a real basic level understanding of what is stem cell therapy and why is it effective, regardless of what avenue we're going to go down of who it's effective for. Just why does it work?
Yeah.
What is it and why does it work?
Well, listen, nothing's magic. So we'll stay at the high level. Stem
Yes.
cell therapy is a strategy to tap back into our body's own self-healing mechanisms. So when you're creating yourself as a fetus with the help of your mother, and you're becoming a formed baby, and you're born, and then you're growing and developing, you're using a lot of stem cells. And a young child, you think about a 3-year-old who scrapes his knee on the sidewalk and, goes crying to mom. Mom cleans it up, puts some Bactine on it, put a Band-Aid on it, kiss it, sends him on the way. 3 days later in the bathtub, that Band-Aid falls off and the scab is almost completely healed. Whereas if I bump my arm on the wall, I have a bruise for 2 weeks. Why can't I'm the same guy I was when I was 3 years old. I'm the same biology and the same cells. Why can't I heal like I used to? It's because I've accumulated junk in my cells, this inflammatory molecular nonsense, and it's throughout the body, and the cells don't work as well, including my own healing mechanisms and stem cells. So, without getting into what stem cells are, it's this natural ability we have within us. We have within our coding and our cells and our DNA and what the DNA represents in terms of proteins and healing, growth factors and things like that. So stem cell therapy means to tap back into that youthful healing approach in a strategic way to give it to someone who needs help, who needs to be reminded at the cellular level how to do that.
So what you're finding, and let's just stick on the injury side, because I do think a lot of people have heard about, high-end athletes or people on the recovery side that or have avoided hip or knee replacement because of this. So for those folks, what are you seeing in that regard as it relates to somebody that is, I don't know, 60 plus years old and
Yeah.
is starting to think about what are my options? What specific results have you personally seen in your practice that people have been able to avoid a hip or knee replacement, let's just say?
Right. So I'm not going to make a blanket claim because the FDA has not yet approved marketing claims for cure or treatment of a
Sure,
disease or condition, and that
sure.
goes PRP for stem cells for all these things. However, I'm allowed to talk about examples, and I have before and
Right.
after MRIs where we've injected biologics into knee structures and hips and shoulders, and I have shown regrowth of cartilage in people who have lost cartilage as a process of part of a degenerative osteoarthritis, sometimes dummied down to the word arthritis, or what's can be called, just to scare people, bone on bone,
Yep.
which is really just end stage cartilage loss. Remember, we made that cartilage in the first place.
Right.
Why can't we turn that factory back on? And that's all it is. You go in the factory, turn the
Right.
lights on, you turn on the machines, you put in a new order for cartilage, and it's doable.
Right. Agreed. Okay, so now let's keep walking down this path because you mentioned something in your kind of overview, if you will, when you started talking about cancer. So most people, I would venture to guess, have understood the hip and knee replacement and stem cell therapy, but have not either heard of or made the leap to, wait, what are you talking about when you're talking about
Yeah.
chronic degenerative disease or inflammation, which is kind of the root cause to everything?
Right.
What are
Hmm.
okay, what are we talking about on that path in that avenue?
Well, the same elements at the cellular level that help remind your cartilage forming cells to stop goofing around and get back to work is a process of the cellular machinery flipping from a defense inflamed mode into a peacetime anti-inflamed mode. And when a cell is out of inflammation, it can function optimally like we want it to. Well, the same goes for the rest of the body. So if you have inflammatory burden, an autoimmune issue, cardiovascular disease, neurodegenerative disease, a lot of these have an inflammatory component. And if you can reverse that inflammatory component, even on a temporary basis, using these regenerative stem cell based biologics, then you can stop and sometimes reverse that process. Cancer is one of them, but that requires a little more strategy to enhance the immune system. So it's a little bit separate that we approach that with a natural killer cell enhancement.
So, is this something that you have seen? Again, I know we're going to stick within the confines of the AMA and the FDA and everybody else that could potentially be listening to us, and I don't want I don't want either of us in trouble. But have you seen folks try this approach rather than chemo or radiation, or are you seeing them doing it in conjunction with, or what are you seeing, and what results have you seen?
We're seeing some of both, and this is relatively new. I've only had my hands on these natural killer cell enhancement vesicles, which from the natural killer cells. I have only had those for about 13 months now. So we've used it on select individuals. It can also be used in an anti-aging setting. Some really good studies on that, but I'm reserving them for patients with cancer so that they have that option. And some of them have had chemotherapy, radiation, more traditional treatments, and now are looking to augment that. Some of them are absolutely, I'm not going to kill myself with chemotherapy and radiation. Not that it kills everybody. I didn't mean to say that. I meant to
Yes.
say it does poison us. That's how it works.
That's its point. It's
Right.
trying to
Yeah,
kill the cancer before it kills you.
exactly.
That's its point.
So, we love more natural therapies. So, the immune system removes cancer cells during our lifetime. We make accidental cancer cells all the time. Natural killer cells selectively take them out.
Right.
So, if we can enhance, because when you look at cancer patients, they have a reduced natural killer cell number and function. So, the strategy here is if we can enhance their natural killer cell function, we can help, attack the cancer, blood cancers, solid cancers, things like that. Some people use it as a preventative. Some people like it as, oh, they're already in remission from another treatment. I want to stack the odds in my favor in that remission. Let's add it there. So we're seeing, interesting results. I have anecdotally, I have a gentleman I'll mention he's got masses in his neck. And he's just not going to have chemotherapy. It's just not going to happen. So he's got this squamous cell from the back of his throat and bulging out of his neck. So we injected. I did some scanning and injected based on the scan these natural killer cell exosomes. They're small vesicles from the natural killer cells that we were able to source. And I even injected some in his tonsil area where the tumors were robust. And now he can swallow better, he can talk better, some reduction in the size. And we're tracking this, but he's had this now 4 or 5 years, and we treated him last year, and he's already improved for the first time. So we may repeat the treatment. We're handling this, as a precision medicine, right? Everyone's different. We don't know how many treatments that person will need. But we are on top of them, we're tracking them, and we want them to have this as an option, right? A full informed consent doctrine requires a physician to tell a patient, here are all the options. Let
Yes.
me help you discuss them so you can make an educated decision. So if doctors are only talking about chemotherapy and radiation, they're really not doing their duty.
Right. Well, and if doctors are only talking from the education standpoint of what their pharmaceutical sales rep has told them, which is where a lot of that education comes from, that also is not, a well-informed. It's a well-informed pharmaceutical choice, but that's where that begins and stops. Okay, so as I said, you and I have a lot in common. So somebody has gone through chemo and radiation, and now their concern is that their immune system is a zero.
Yeah.
And they're worried about how am I going to move through life being depleted and wiped out of anything, and they've just tuned into this episode and saying, "Well, I wish I would have heard you two talk a year ago, but now here I am." Is is there hope for that person in that regard in just rebuilding themselves if they have gone down a different path prior?
Oh, sure. We would be talking to that person about certain vitamin IVs, high dose vitamin C, anti-inflammatory IVs like curcuminoids. We would be talking about peptides to reset the immune system, thymosin alpha 1 to improve that. We might talk about, some biologics to stimulate the white blood cell production in the bone marrow. We might talk about bone marrow stem cell enhancing stimulation at the biological level, like with stem cell derived exosomes. Those are the kind of approaches we would be looking at with an individual based on labs. And of course, we want these people eating right and exercising and sleeping and having
Reducing their
reduced
stress.
stress. Yes, jinx.
Yes.
so, but yes, all that we want that, all this, and then we might talk about hormesis, fasting, hot sauna, cold plunges, high intensity exercises, things that are a bit stressful at a mild stress on the cells to build resilience and adaptability. And that stimulates the immune system. 3-day fast is an amazing immunostimulant.
Well, perfect. You should come here and co-teach a retreat here with me. We have everything you just mentioned. We have here for those reasons. There is eustress, there is good stress that does help build resiliency and is all part of the path that hopefully everybody is considering as we move forward into this year. Okay, you said I've only been doing this for a handful of months, and a couple of times you said I while this is great for anti-aging, I want to reserve what I have for folks that, not that anti-aging doesn't need it, but in reality, when we're talking about life-saving things or things that really have a big impact, this is what you're using this for. So it sounds to me like you have access to something that maybe isn't commonplace.
Yeah.
So I'm curious now because I'm certain they should be Googling, let me just run over to my, strip mall. I know they do, IV therapy. Maybe they offer
Yeah.
what you're
Yeah.
offering, which we know they don't. So
Yeah.
now I want to know how rare is this? How new is this? And how did you manage to get in the fold of it?
Because I put my foot in the door. I'm a neurosurgeon. We don't take no for an answer. I've been doing regenerative medicine and peptides and things for over 7 years now. But the natural killer cell exosomes, the one we're
Yes.
using that you're speaking to here, I've only had for about 13 months. There were 2 sources that I could identify about 2 years ago. And one was in China and one was in Europe. And I had been in talks with them. I always vet my sources. I want to talk to your scientists. I want to see your certificates of analysis, your testing, and everything you do, the cleanliness reports of your lab, who regulates the lab. So even here in the US, we can't make marketing claims, but the FDA does certify the labs we buy things from.
Right.
So we have the tested, clean, approved, handled specimens. But I was in talks with both these labs. China, the scientists were very friendly, but their government just wouldn't let them share. They were willing to do so. So we finally found a source in Europe, and we figured out a way to get them here, and we made it happen at significant cost. And there's a language barrier. I have to talk to the scientists and get all this done. So I really work to get things to make available to my patients the right to try these things. And that requires some effort on the doctor's part. I don't just sit back and wait till a representative steps into my office, and plenty do, to tell me what's available or what they want to sell me. I go out and get what I think my patients would benefit from and what my own friends and family would benefit from. My patients are no less treated than someone close to me.
Well said. And we're going to get to, before we wrap up, trust me, how people can find you, because I know that people are already thinking about that. So we're going to get there. So stick with us. Okay. So as I said, we're going to have some of this be on the science side of what is this and how does this work and who is this for. Before I switch gears over here into mindset, is there anybody this isn't for? Is there anybody that you automatically are saying, "You're just simply not a candidate. If this is your background, unfortunately, this may not be for you," or
Yeah.
is anybody a candidate, quite frankly?
Well, I mean, listen, if you're smoking 2 packs a day and you're going through the drive-through every day and you don't get off the couch, don't waste your money. So, I mean, can you have it? Sure, but I'm not gonna recommend it. We have to set the foundation and get these people to have an anti-inflammatory lifestyle from the top down first. Hormone optimization, all these things play a role in suppressing inflammation so you can get the most out of it. We don't use the regular stem cell derived biologics in people with cancer because we're not sure what that's going to do. We only use the natural killer cell exosomes for those people. And we are sourcing new and different selective tissue specific biologics all the time. We just ordered some very specific uh, skin stem cell derived exosomes, which are vesicles, for hair growth. And we will be looking at even better musculoskeletal biologics for cartilage regrowth and things like that. Neurological stem
Wow.
cell derived items for problems of the nervous system, brain injuries, what have you. So it's not everything's for everyone. And we're trying to get more specific because general stem cells are great, but it's a shotgun blast. It's not specific necessarily, but they are heavily anti-inflammatory.
Well, this is fascinating. I look forward to, watching your work, especially you touched on one that's near and dear to my heart, which is traumatic brain injury. And we are making lots of advances, trying different therapies. Very specific types of red light therapy have seen tremendous improvement. So I'm thrilled to hear you say that. You offered a beautiful segue into mindset, which is if you're smoking 2 packs, drinking like a sailor, eating who knows what, that all speaks to mindset, right? And we're the same. There are people that don't come into my practice for the same reason. I'm not here just to hit a button to make the problems go away that you want to recreate tomorrow. So we kind of have to be in a place of saying I'm willing to do what it takes. That said, when mindset does show up, what do you see? And I'm interested in this because I'm gonna add it to my repertoire of things that I can use when I talk to people. What do you say, or how do you help people get past the conditioning of the medical community of this is the way it's always been done? You're over here, the two of you talking about newfangled things that who knows what. And it's just really difficult when you've had 40, 50
Yeah.
years of conditioning that the guy in the white lab coat is never going to lie to you and only has your best interest at heart. And, you're a rare one. Surgeons like to cut, doctors like to prescribe. So, what do you say to people to get them to just consider a different approach?
I,
It's a challenge I have. Is
no,
so I'm asking you for me personally, or what you've come up against.
it's not a challenge. I don't have to do it. The people that seek what I do already have an appetite for it. They already don't trust the
Got it.
government, the sick care system, the Kaisers of the world, the institutional healthcare. They have a 5 or 10 minute doctor's visit. They can only talk about one problem if they have seven. They are hassle at the pharmacy trying to get a prescription filled, insurance denying things, pitted against their doctor when it's really an insurance company, laughing its way to the bank. United Healthcare makes more in a day than they pay out in a year. So rush to your stockbroker, buy United Healthcare. The
Right.
the it's they find me. It's easy, and you open the door. You spend time with them. You talk to them. You go through their lifestyle, their health. They go, "Wow, no one's ever done that before." It's easy for people to have an appetite for this, even if they've never heard about it before. People don't understand what real doctoring is supposed to be about and what it's all about because they've been, like you said, conditioned by a system. And it's really the older generations that have that sort of, well, I trust my doctor. And every now and then I get someone who said, well, my orthopedic doctor said stem cells are illegal and you can't have them in the US and they don't regrow cartilage. I say, okay, go back to your doctor. I'm here if you need me. I'll be happy to help you. But I can't, I'm not gonna, I don't want to twist anyone's elbow to make a decision. So I
Right.
find it very easy because people are just completely disenchanted. So I see biohackers and health enthusiasts and anti-aging enthusiasts and longevicists and all kinds of people who come to me and say, I say, hey, what I'm offering you is not yet approved for marketing claims by the FDA. And they say, great. I have even more confidence in it then.
And I do think that in the last couple of years, we have come farther than we have in the last 20. And maybe I'm hanging on to the amount of uphill that I went through, 20 and 25 years ago, certainly compared to the last handful of years where biohacking has just now become a common term. What is out there that I can do to really improve myself from the inside out? So so that said, if somebody is listening and they're saying, "All right, well, I'm on board. I want to have that conversation." How do people find you? What is the way that not only can people find you, but can continue to learn? What are the best
Yep.
resources out there
Yep.
that you find, hey, this is because it hopefully it's not, TikTok, Facebook, and Instagram. What are the reliable sources of information that you would say, hey, if you want to start learning, go here. And if you want to know more about me and what I'm doing, check this out.
Well, I do like when people find things on social media first because it does stimulate an idea to go research. You know, uh, Many things on there aren't 100% accurate. Sometimes they're completely inaccurate, but it gives you like what the conversation is about, peptides or GLPs or stem cells. You can look that up and go to the internet. Everything we do is based upon published medical literature somewhere. Most of that, again, is in Europe and Asia. Look at the literature, see what's out there. If some of it's very difficult to interpret because it's poorly written. A lot of medical literature these days are horrible, even peer-reviewed stuff. They can't even write a title, to explain what's going on. But and then seek a clinician, who can talk to you about this, because what you really want is an education, right? So there are many clinicians like myself who have resources online. We have YouTube videos. I have some lectures I've given to physicians that we put online for other people. It may be a little bit above your head, but it's something to sink your teeth into and so you can make a really good list of questions, and we will give you the time to answer them. This isn't a 5-minute Kaiser visit. So that's a place to start.
And where
And
is
then,
that? So these YouTube videos and all of that, where if somebody says, I want to hear more from you, where are they going?
oh, well, and I'm not the only voice. So I do like when
Sure.
people listen to others too, and then come compare notes with me. Let's talk it through. So, our brand is Recelebrate, RECELLEBRATE. We're celebrating the renewal of your own cells. So if you just search that word, you'll find our YouTube channel. You'll find our website, which is in the process of being overhauled. You'll find our social media posts, and it's a place to start. And that's kind of what we recommend. And I do direct people to other clinicians' websites. I have colleagues that I trust. There are also charlatans. How do you know, right? Get a bunch of opinions. If they over promise or if they violate the FDA marketing restrictions on these things, then they probably are a little too exuberant and don't exactly know what's going on. So, and a lot of it comes down to the science. Do you understand the science? Do you understand how a stem cell works and doesn't work, and what it gives off and how it influences your cells? For example, stem cells really don't do the job our cells do. The stem cells remind them.
So how rare is what you're doing? I mean, are there, especially when we're talking about the natural killer cells, I mean, are you super rare in the United States at this
Well,
point?
on the stem cell and exosome front, no, there are plenty of us. It's
Okay.
just difficult to advertise. We can't advertise those words on Google or Facebook. It's restricted. So social media is the place you might go find us. Natural killer cell exosomes, I may be the only one I'm aware of. There might be a few others.
Wow.
So the lab in Europe, I've actually told other colleagues about and introduced them. So they may be acquiring them too. So I'm probably not the only one any longer. Natural killer cells you could probably find, but that's quite laborious. You have to have cells, injected in you, And we try to get away from direct cell treatments. We try to go more to the cell messaging, which is more
Got it.
potent and efficient in my view, and more specific. And also, you don't have to get anyone else's DNA because the signaling usually doesn't have appreciable genomic DNA.
Okay. Makes sense. So somebody now is saying, okay, is it even an option to get in to see you? Can somebody actually get in to see you at this
Yeah,
point?
yeah, yeah, yeah.
Okay, so it's still doable.
Oh yeah. Yeah,
Okay.
my time isn't garbled up doing long spine surgeries. So I do plenty of joint and spine injections, but those, the hard work there is targeting and figuring it out ahead of time. The actual procedure is very short. So most of my time is now in the clinic, and I know I'm a surgeon, but I like my patients awake. So I like to talk to them and get to know them. So the vast majority of our interactions are by video, just like how you and I are meeting now.
Right.
And we gather people's imaging, we order it if necessary, we get their labs, we get their records. I'm detail oriented, a bit, compulsive in that area. So I really want to make sure I don't miss anything. And we'll order whatever tests are necessary. We only invite people here to my clinic if there's something we can do for them. So, and luckily we're
Got
in
it.
Las Vegas, so people don't mind coming, make a weekend around it. See a show, get a nice
Yeah.
dinner.
And
You know,
one of the easiest places to fly into from frankly anywhere in the United States. I mean, you're
yeah.
very easy to get to.
Yeah.
And I am guessing, maybe I'm wrong here, but is this not covered by insurance?
It's not. It's not yet approved for insurance coverage, generally speaking. However, you can use an HSA or flexible
Oh,
spending account that you
okay.
control those dollars. It is deductible within the tax guidelines. There's a certain amount you have to spend first, and then certain percentage of your adjusted gross, and you can deduct the rest. So there are different ways that people can try to sort of internally cover it, at least parts of it. But the costs have come way down. I know you can go to Costa Rica and spend 30,000, but we might do a knee procedure and you're looking at, $8,500 or something like that. So it's not crazy.
Okay. Funny enough that you say that because I was thinking that, and I do know of a place in Costa Rica that starts at about 30 to 45 grand to
Yeah.
have most anything done. So
Yeah.
that's good news. And I would imagine to the point, it's like any new technology, right? That things are insanely expensive in the beginning. And I hope this is something that becomes a little more available and a little more
Yeah.
accessible, and people
Yeah.
have more of an option out there in the world. So I will have all of this linked in show notes for people. So if you're working out at the gym, as you should be, you can just go home and check on it later, and I will link to everything so that people can find ways to get a hold of you. It's been a complete pleasure of mine
The
to
pleasure was
chat with
mine.
you. Oh, truly. So I close the show every time with the same question. I'm curious to what your answer is. But Dr. Gross, what is one thing that you absolutely believe to be true?
That we don't know everything and we have to keep looking.
Okay, beautiful. I think that is probably one of the healthier things too. It's one of the things that I'm embracing heavily into this upcoming year here is don't be so sure. We never know. As soon as we've shut down the walls, I know everything on any topic. You've closed off opportunity for a new idea. And, hopefully, if nothing else, that's what this is for folks is maybe it's a new idea, or maybe this is the tipping point. All right, I've heard this now 10 times. I finally pushed him over the edge, and I've got to really give this some, if nothing else, some consideration. So I appreciate your knowledge and your enthusiasm around this topic. I most appreciate of everything that you've said that you don't sit back and wait for the information to come to you, that when you've seen a good idea, that you go after it. That's one more thing I hope that people embrace and heard in this conversation, that is something we all should be doing. Don't sit back and wait. Take your health into your own hands and go seek what makes sense and do your homework. And I think that people are going to get a lot out of this episode. I appreciate you and your time immensely. So thank you so much for being here.
Thank you for having me.
All right. And thank you so much for tuning in to this episode of the Game Changer Podcast.